Hi, my name is Tessa Cregan, and for my sixth sports med project, I chose to do it on rehab for Tenodesis surgery. In this project, I will go over the anatomy, the causes of the injury, the surgery video, the 5 phases of rehab, and new ways of rehab. So, for anatomy, the main things you want to know are the biceps brachii and the long and the short heads of the biceps brachii. In the right side of this picture, you can see in the left of the right picture, you can see the completely uninjured biceps brachii, while on the left side of this picture, you can see a ruptured biceps brachii. And that is why this surgery is needed, to reattach the ruptured bicep brachii. The main causes of this injury are sports and other things that you do overhead, so like swimming or basketball, as well as things like construction where you're lifting things over your head a lot. Age can also be a factor. As you age, your arms become worn and they can tear easier. You can also be predisposed by having a slap tear, which can, along with the slap tear, cause your tendon to detach.
In this animation,
Video
we
of
will show the treatment of a damaged biceps tendon with a tenodesis procedure. The biceps inserts into two places in the shoulder. The tendon that inserts into the socket of the ball and socket joint, the long head, may be damaged or cause pain in the shoulder. In this animation, the painful biceps tendon is moved from its original position to one lower down on the arm, also known as a biceps tenodesis. First, your surgeon will place a suture around and then through the biceps before separating it from its original location. Through the small incisions in the skin, your surgeon uses a series of instruments to prepare a new hole in the arm bone or humerus. Finally, the biceps is placed into the bone with a screw-in type anchor. The remaining suture is removed. This completes the biceps tenodesis procedure.
So after you have the procedure done, you move into phase 1 of rehab. And phase 1 of rehab, the goals are to manage your pain and swelling. And you also have to wear a sling for at least 3 weeks. And then once you get clearance from your doctor, you can start weaning off the sling. And you also want to restore your passive range of motion. The precautions during phase 1 are not doing any active range of motion. You also want to keep your incisions nice and clean and dry to not have any infections. And you also can't lift any objects. Here are the exercises of phase 1. The top right picture is scapular retractions. The top left picture is someone doing passive range of motion. And then the bottom picture is ball squeezes. Phase 2 is 4 to 6 weeks after the injury. And for the goals of phase 2, you want to manage your pain still, taking NSAIDs. And for this phase, you can do shoulder and elbow active range of motion. You can also do light desk work like typing. The precautions for this phase 2 are avoid putting any stress on your arm to avoid further damaging any of the tissues. You also can't lift with the affected arm that the surgery was on. And then for the exercises, range of motion, you can start doing shoulder active assistive range of motion, shoulder active range of motion, elbow active range of motion, and also manual therapy will be done as well as isometrics. Something else that you need to avoid during this phase is running. Even though it's your legs, you still move your arms, and that's something you can't do. So for phase 2, shoulder isometrics in all of the positions that are in the left picture, and then stretching, so a crossbody stretch like the one in the top right, and then the middle picture is called a sleeper stretch, where you push your arm down with your other arm while laying down, and your arm is at 90 degrees. For phase 3, the goals are strength, control of your muscles, and then also restoring endurance, so doing things for long periods of time with that arm. This phase is 6 to 8 weeks after your surgery, and there aren't precautions except for you can't start strengthening exercises aggressively until you have full range of motion in your arm. And for this, you'll do exercises with resistant bands and like supination resistance, tricep extensions, wrist extensions and flexions, and light bicep curls with just a band. For phase 4, the goals are to be pain-free, focusing on loading your shoulder, and phase 4 is 8 to 12 weeks after your surgery. The only precaution is not to swim because that's an overhead exercise and that still is not something you're able to do. And for range of motion and mobility, you want to continue with the same range of motion exercises that you've been doing while adding active resistive range of motion exercises, as well as a push-up progression. As you can see in this picture, they're doing a push-up progression. You can start running and start thinking about running during this phase while you can't swim. In these pictures, you can see in the right, you can see her doing a resistive exercise with a band, and then on the bottom right, you can see her doing prone rowing. For the final 5th phase, which is 12 to 16 weeks after surgery, you should have almost full function and strength of your arm back, and you should be able to turn to your work and your sport after the end of this phase. You want to avoid putting anterior stress on your shoulder, as well as keeping pain-free range of motion, which you should be able to have by now. And for phase 5, you want to start doing plyometrics as well as sport specifics while still continuing with phases 3 and 4 exercises. So here are exercises that someone would be doing during phase 5. So on the right side, you can see them doing ball drop-in catches. So on the top one, it's a prone 90-90. So his arm is at 90 degrees, and he's dropping and catching the ball. And then below that, he's just has his arm straight out, and it's called prone T ball drop and catch. And then on the other side, you can see one of the pictures is of them doing a chest pass, and then just a drop and throw down with a ball, just to continue strengthening the shoulder and arm even more. Something else I found was 2 different ways of therapy. On the right side, you can see he's getting cryotherapy, which reduces inflammation and helps you heal faster. And on the left side, you can see her getting laser therapy, which helps regenerate tissue and also gives her better circulation in her arm and shoulder. And in combination with all of the other therapies I said, whilst being a little bit more aggressive, this seemed to be also effective. Thank you. Any questions?